Hello and welcome to the Clinical Care Options podcast. I'm your host, Hilary Tingal. Today's episode features Marlyn Mayo, MD from UT Southwestern Medical Center, Stuart Gordon, MD from Henry Ford Health, and Pam Rivard, RN, a patient, discussing the burden of pruritus in PBC and how it affects quality of life. This episode is part of a larger educational program titled Itching for More, Improving Care of Pruritus in PBC. To follow along with the slides, please visit the show notes for this episode. Now, let's get started as Dr. Mayo introduces the patient perspective.
All right. So for the first part, we want to ask our patient representative, Pam Rivard, just to start us off by describing what your personal experience has been with itch and PBC and kind of what impact on your life it's had.
Thank you, Marlyn. Good afternoon, everyone. It's my privilege to be here. Itching. I would have to tell you that itching is everything that you've heard your patients say that it is. It's serious. It's mind-boggling. It literally turns into an issue of wound care when you're through scratching. Scratching can take place at night. Contrary to what I've heard in many places, you wake up with scratching. My husband had told me years ago, you scratch like a dog with fleas all night long and you don't wake up. And itch and itch and itch. So even when we're taking precautions not to break our skin, not to cause wounds, not to leave bruises, the itching is so insane, it happens even at sleep. And I would say to not labor this point, we can come back to this at another point. In all of the assessments, we're asked to rate mild, moderate, or severe. I would suggest that in the course of a 12-month period of time, I cover all three categories. It's light scratching, it's something with touch, and you go on about your day. Sometimes it's moderate, it's pretty persistent. It's going on for 5, 6, 8, 12 hours. And sometimes it is wild, where even as a healthcare professional, I literally sit in the evening and go, do I need to go to the emergency room? This is that bad. So that's been my experience. The itching is real. It comes and goes. I get frustrated with some of the assessments because I may go through a 3 or 4 month period of time where I'm not aware of, not recalling itching that needed to be reported. But then other times, like a migraine, it just comes out of nowhere and hits hard for weeks on end. So that would be my summary of itching. It's real.
So we're going to talk just briefly about the patient burden of pruritus. So cholestatic pruritus, you all probably know that pruritus is the same as itching, and cholestasis just means impaired bile flow. And really you can get pruritus from any cholestatic disorder. We're focusing today on PBC, but certainly you can get it with other causes of chronic bile duct obstruction. The PBC pruritus is indiscriminate. And what do we mean by indiscriminate? It affects people regardless of their status. So here's data from a study from the UK at almost 500 patients with PBC. And what it shows you is that it occurs pretty equally between males and females. It is present in all ages with a very broad age range. And the severity does not correlate with other disease markers that we have. Doesn't correlate with how long you've had the disease, what the lab values are, or what the degree of liver fibrosis is. And I found it interesting, Pam, that you said some days are worse than others. That's exactly what I hear from my patients as well. Although in this very large UK study where they were actually grading, the severity was similar on what was considered a normal day as opposed to a really bad day. And just to highlight one patient's description, this is a quote that sounds very similar to things that I've heard before also. Itch is more than just an itch, though. Itch is days and days of torture. Thousands and thousands of ants and spiders crawling under your hands, your ears, absolutely everywhere. And that's something we hear a lot, that it's often a bug kind of crawling sensation, and that it's not on the top of the skin, it's just under the skin where they can't get at it. So the impact of pruritus on day-to-day life is pervasive. Itching interferes with sleep. Interference with sleep worsens the fatigue that you might have from the disease to begin with. This can lead to depression, All of these can affect inability to work. And if you're not able to work, then you also can get more depressed and fatigued. And it really is a multifactorial consequences. So this is interesting data where they assessed health utility scores of patients with cholestatic pruritus. If you're not familiar with it, that's a quality of life measurement that just assesses overall quality of life. And if you have a PBC patient that doesn't have itching, their quality of life is similar to somebody who has hepatitis C or even someone who has hepatocellular carcinoma from day to day. But once you start to get mild or moderate pruritus, that quality of life drops significantly and is really on a par with somebody who has COPD or end-stage renal disease. And for somebody who has severe pruritus, that quality of life is similar to someone who has severe Parkinson's disease. All right, so we're going to try some discussion. I'm going to start with you, Stuart. We know that healthcare providers often fail to recognize the burden of pruritus. Why do you think that is? Or has that been your experience, and why do you think that is?
No, I think that's the case. Thank you, Marlyn. That was a nice overview. And I think the most obvious is the failure to ask the question, do you itch? I can't tell you how many times you say those three words and the patient's eyes light up. They've never been asked that question before. So I think that the first and foremost is asking the question. And then the next is to sort of probe the severity of it. You were talking about bugs and fleas, and I had a patient just recently, who really didn't complain about itch, but when I talked about ants crawling and that sort of a thing, she thought that her two dogs had fleas because she was feeling crawling up and down her legs at night. And so it's not necessarily an itch per se, but it's, when you describe it and probe a little bit more deeply, I think it'll eventually come out. And then, the severity is another question. When you ask, do you have a back scratcher? How often do you use it? You'll find out that they're actually scratching their backs all the time. And so I think it's just a matter of asking the right question and probing.
Yeah, I've noticed that too, that sometimes patients, maybe because they've lived with it for so long, will sort of downplay the presence of the pruritus or attribute it, oh, my skin is just dry, or I have fleas, or attribute it to some other cause when it really is coming from the liver disease. Why do you think patients, and this is probably more for you, Pam, why do you think patients don't always share with the provider how bad their itching is or what the impact of the itching is?
Probably a couple of categories. I would think sometimes we're very aware of the limited amount of time we have with the doctor. And there may be other issues like the fatigue, abdominal pain, whatever it is that you're seeing the doctor for at that visit. With patients like myself that have been dealing with it for almost 2 decades, and as I told my family doctor and my gastroenterologist, I've been telling you for 50 years something was wrong. And then all of a sudden I get the diagnosis. But when I looked up all of the symptoms, I had had those for decades. I had been through dermatology. I had been through allergy. And I think as a patient myself, I'm speaking for, I had put many of those things to bed. I had found some alternatives, some things that helped me to some degree or another. And I just don't necessarily bring it up now. I did not actually have a first contact with a hepatologist till about 3 years ago, maybe 4 years ago. So up until that time, it was strictly primary care who knew that I itched, and gastroenterology that just every time I said it, he just told me, learn to live with it. We have nothing for it, learn to live with it, and he just would move on. So those would be the reasons I would say that I don't bring it up.
So these are the take-home points from the last section, that cholestatic pruritus is frequent, it's often a severe symptom, and it can dramatically impact day-to-day life. When you brought it up, if you don't bring it up, do the doctors ask you? I mean, what's your experience about whether they ask you and if how much they delve into it?
They don't ask. And I will, with a little caveat here, as a patient, I'm sure each one of you have had a contrary patient that gives you some pushback. Again, myself, I've kind of settled the issue. They don't bring up the itch. I think in their mind, if I'm an established patient, they're waiting for me to bring it up. I might get asked by the MA when I'm sitting there having my vital signs taken before the doctor walks in. I guess the question, if I'm asked, Marlyn, what is the itch like? It's kind of a non-serious question, and they expect me no matter how I answer the question, I'm going to get the same answer, right? There's nothing for you, or here's a couple of things off-label that we can try. So I'm equal party in this, not participating in bringing up the itch. I put some blame on myself as the patient.
I imagine that's not very motivating to talk about it if you're going to get the same response every time that there's something we can do.
It isn't, and I had
but it's not true. There are things we can do, right?
And I had spent 20 years with dermatology and allergy and never got to the bottom of it. And they would wring their hands, they would lament, we don't understand, we don't understand, we don't know what to tell you. So through all those different disciplines, like I said, me specific as a patient, don't really go there. I had an experience, I think the last time I saw the PA last year in hepatology, I had a horrific, I want to tell you, this was like in the top 5 itching incidences. And it was an unusual place. It was on the back of my calves and above my knee, behind my leg. And when I had gotten up in the morning from evening scratching and evidently all night, I looked like I was ready for the hospital. I was black and blue. I was literally bleeding. I felt like the itch had come from the basement membrane. And it was just a horrific mess, friction burn. And I had got asked by the PA, he's very thorough, how's the itch? And I said, it's been great for months, but you got to see this. And I pulled up my pant legs up to my thighs, and he almost fell out of the chair. And he spun around and started putting labs in. And I said, I think he's putting in a PT-INR to see if I'm bleeding. And sure enough, he was. It was that bad. I was massive bleeding under the skin from the itching. So
good story. And it gets back to that feeling that it's under the skin. So people just keep digging and digging and digging until they bleed.
Thank you, Doctors Mayo and Gordon and Pam, and many thanks to you, our listeners, for joining us. As a reminder, to view the full program, Itching for More, Improving Care of Pruritus in PBC, please click the link in the show notes. And be sure to check back regularly for more episodes on important topics.